Hello everyone, my name is Zafira Amanina. So today I would like to present about eating disorder. What is eating disorder? Eating disorder are serious mental health condition characterized by persistent disturbance in eating behavior and related to thoughts and emotion. They often involve preoccupation with food, body weight, and shape, leading to unhealthy and sometimes life-threatening eating habits. Although eating disorder can affect anyone, they primarily affect teenagers and young adults. Individuals with eating disorder may experience various visual problems. For instance, night blindness due to the vitamin C deficiency. Low magnesium can also impair the eye muscle function, and insufficient in fatty acid will disrupt the retinal health. Moving on, we will be talking about the types of eating disorder. There are three types of eating disorder. The first one is anorexia nervosa. It is characterized by extreme restriction of food intake, intense fear of gaining weight, and distorted body image. Individuals with anorexia nervosa often see themselves as overweight, even when they are actually extremely underweight. They also tend to exercise way too much to prevent overweight. There are various factors that lead an individual to become anorexia nervosa. The first one is they have altered brain function and structure. They have altered brain function and structure. They are deficient in neurotransmitters dopamine, which contribute to eating behaviors and reward, and serotonin, which contribute to the impulse control and neuroticism. They also have different activation of cortical limbic system, which contribute to the appetite and fear. And lastly is diminished activity among the frontostrial circuits, which contribute to the habitual behavior. Besides that, anxiety, depression, and surrounding influence can also lead to an individual having anorexia nervosa. The side effect of anorexia nervosa is the individual will become malnutrition, will have osteoporosis, organ failure, and also night blindness, and also in worst case is optic neuropathy. For example, a 17-year-old student who is very focused on her appearance, although she is very slim, she constantly feels that she's fat whenever she looks in the mirror. She will start skipping meals and eventually eats only a small apple and drinks water throughout the day. She also will exercise excessively even when she feels tired and dizzy. Over the time, she loses a lot of weight. Her period will stop, and her friend will notice she looks pale and weak. Even when people tell her that she is too thin, she insists that she still needs to lose weight. She will become withdrawn and avoids eating with others. The second types of eating disorder is the bulimia nervosa. Bulimia nervosa is a disorder that is characterized by binge eating and inappropriate compensatory behavior to control weight, such as self-induced vomiting, extreme physical health, fasting, and more. Individuals with bulimia nervosa often maintain a normal body weight, which makes it harder for others to detect. There are various factors that lead to an individual to have bulimia nervosa. The first one is patients with bulimia nervosa have widespread abnormalities with diffuse alteration in white matter structural and functional connectivity, particularly within the appetite regulating and taste reward pathway. Besides that, mental stress, social pressure, and anxiety can also lead to an individual having bulimia nervosa. The side effect of bulimia nervosa is electrolyte imbalance, dehydration, blurred vision, or in some cases, eye twitching. For example, a 20-year-old university student often feels very stressed and overwhelmed by her studies. When she's alone, she eats a large amount of food very quickly, like a whole pizza and her box of cookies and chips in one sitting. After binge eating, she will then feel guilty and scared of gaining weight. To fix the guilty feeling, she will secretly force herself to vomit, take laxative, or exercise intensely for hours. This cycle of binge and purging happens several times a week. Even though she already maintains a normal body weight, her teeth then will become very sensitive and she will often feel dizzy, tired, and ashamed of herself. Binge eating is characterized by chronic and compulsive overeating. A patient with binge eating disorder will always consume large amount of food in such a short period of time and will then feel guilty or distressed after eating. There are various factors that can lead to an individual having binge eating disorder. The first one is family history. The second one is dieting or limiting calories throughout the day will then trigger an individual to have the urge to binge eating. Beside that, mental health conditions such as stress, anxiety, and some individuals also use food to cope with emotion and also depression. The side effect of binge eating is obesity, diabetes, which can eventually relate to diabetic retinopathy, and high blood pressure. For example, an individual who often feels stressed and lonely after work, the way he will cope or she will cope with her stress, she or he eats large amount of food in a short period of time, like several burgers, fries, and a tube of ice cream. Even when they are actually not really hungry, they will actually eat quickly and secretly, afraid that others might judge them. After the binge eating, he or she will then feel very full. However, they will also feel uncomfortable and deeply ashamed of themselves. He or she will promise himself they won't do it again. But the cycle will keep on repeating. Whenever they feel stressed, the cycle will keep on repeating several times a week. Unlike bulimia, they won't vomit or use laxative. they will just keep on eating and they will actually gain weight over time, which will eventually lead to several health problems.
I'm Zaf&Yuzhe, and now I'm going to talk about the common signs and symptoms of eating disorders. First, it can be classified into three categories, which are physical symptoms, behavioral symptoms, and psychological or emotional symptoms. The physical symptoms are significant weight fluctuation. That means it can be either a significant weight gain or a significant weight loss. Next, they tend to feel very tired, dizziness, and faint. Moreover, they are also experiencing a heart palpitation where the heart pumps very fast. And in some cases, they experience unusual sweating, delayed menstruation, or no period at all. Then, gastrointestinal issues such as constipation, acid reflux, and bloating. Lastly, they might have cold intolerance, where they always feel cold. While under the behavioral symptoms, they tend to have restricted eating or skip meals frequently and purge, such as through forced vomiting, misuse of laxative, diuretics, or enemas. Other than that, they tend to consume a big amount of food very fast in a short time, exercise excessively, hide or throw food away, and always check themselves in the mirror. However, in the context of psychological symptoms, they have experienced changes in mood, such as being socially withdrawn, anxious, or depressed. Besides that, they may be very afraid of gaining weight, and lastly, they often think that they are overweight or obese even though they are just underweight. Next, what to do if you think you have an eating disorders? Of course, you will look for treatment, right? Basically, treatments for eating disorder include psychological therapy, nutritional support, and might help with medications. First of all, you must seek help from professionals in eating disorder treatment. For example, a psychologist or mental health therapist for psychological therapy, which is also known as talk therapy. Basically, what they do, they help patients to change unhealthy thoughts, emotions, and behaviors related to food, body image, and self-esteem. Besides that, it also teaches problem solving skills, stress coping strategy, as well as making your mood better. The examples are cognitive behavioral therapy (CBT), family based therapy (FBT), and dialectical behavioral therapy (DBT). CBT can be efficient for bulimia nervosa and binge eating disorder because it assists patients to change distorted thoughts or behaviors about eating patterns, while FBT are useful for teenagers with anorexia nervosa. In this therapy, family members supervise eating patterns and help to achieve a healthy weight until you can do it on your own. While DPT are specialized therapy designed for bulimia nervosa and binge eating. It teaches you how to manage stress and control emotions. Moving on, you may also seek help from a registered dietitian to understand more about eating disorder, helping to achieve healthy habits. And the goal typically includes understanding how nutrition affects our body first, developing structured meal plans, and reset stable eating patterns. After that, the third treatment for eating disorders are medicines. However, medicines alone can't cure an eating disorder. They must combine with psychological therapy in order to be efficient. And the examples are antidepressants and antiepileptics. Antidepressants are most effective in treating binge eating disorder. It helps to suppress binge purge cycles and reduce symptoms of depression. In conclusion, eating disorders are serious psychological conditions that primarily affect physical health, emotional well-being, and behaviors in daily life. Not only that, it also threatens one's vision due to nutritional deficiencies. Early detection of eating disorders are crucial to prevent further complications. Understanding the available treatments are key steps toward recovery. If you think you have an eating disorder, please remember that you are not alone and support is just a step away. So please do not hesitate to reach out to a healthcare professional like a psychologist or nutritionist. This is our references and that's all from us. Thank you so much for your time.